Americans. And because we can now do a lot of things through technology, we can do the skills training, the skills competency. So it has opened so much opportunities for us that it's made it a lot easier to actually cross borders, cross globally, neighborhoods, or actually locally, without stepping out of your community or out of your home. So we do talk about nursing without borders too, so it has helped us a great deal.
Thank you very much, Dr. Anahet. From your presentation and from your experience in different Arabic culture, like in Oman, you said Lebanon, something like that. So what do you think about which one of the challenges you found it will be very difficult to overcome it? Which one is the most difficult one for the challenges we can cover it?
Well, I would say putting bread on the table is the most important one. So salaries or wages are very important to overcome. But I have to say that the Arab world especially has some low resources countries, but it also has high income countries. So in the Arab world, there are a lot of opportunities if the nurses do as well, that they can go to Saudi Arabia, Oman, or the Emirates and still get very well paid. I come from the American University of Beirut, but I did my Fulbright in Jordan, and I have to say one of the places that impressed me a great deal was Jordan, because the ministry actually and the king and the queen, they personally supported the nursing profession by funding political people's daughters and sons to go into nursing, and they were in the media all the time. So at this point, if you're listening to the news in Jordan, they're keeping male students out of the university because there is a larger number of male students that are trying to get into the university. So I think Jordan has done a fabulous job. And I have to say, if you go to University of Jordan, there are more PhD prepared faculty than many places in the United States in certain programs, because the government, I think Jordan is one of the highest countries in terms of sending students for PhD education, especially in nursing. So that has been an incredible success story. And I know that Egypt has done a lot in terms of, because whenever I go to Oman or Saudi Arabia, I see a lot of Egyptian nurses there and faculty, right? So I think that if you can lead the region and make sure that you are applicable and flexible, just like one of our speakers said, to make sure that the local priorities are also included in your national agenda. Don't go do whatever the Americans are doing. Do whatever Americans are doing that applies to your country, and make sure that whatever you have is part of your national agenda to be successful.
Sorry to burden you, but really it was very interesting to hear about partnership. And I would like to know if you have certain procedure or ideas or some protocol. How can we have a partnership so that we can improve our quality of nursing and have exchange between students, staff, and so on? Thank you.
I can give you a lot of examples in terms, because I travel a lot, and we do a lot of memorandum of understanding, which is the first step for partnership, which means that my provost and your provost, or equal to whoever is the provost, has to sign an agreement that includes the dean, of course. The first person will be the dean, that philosophically we agree to work with your institution. And the reason why we write that contract is, first we have to make sure that we talk to you, that your students, your faculty, and our students and our faculty can actually exchange research, education, or teaching. because it will be useless for me. I was in Mexico 6 months ago, and no student spoke English, and they didn't have a master's or PhD program. So for me, it was impossible to have a memorandum of understanding unless I had faculty who spoke Spanish and were able to go there. But when we are writing a memorandum of understanding with the Children's Cancer Hospital here, where we are exchanging, we're going to have online programs for the hospital, and I hope that will work for you. We're hoping we have an applicant from Cairo University. We're hoping that the student, if she comes, she will come back and bring a lot of experience with her. We have asked faculty to come here for short-term courses. Also, we have planned on having some of the students or faculty to come to Boston for short courses, because as you know, Boston has the world's best hospitals. We have a relationship with Dana-Farber, with children, so everybody wants to come and do a couple weeks there to learn from the best hospitals. Those are the way we work. I think the most difficult thing that we experience at me as a dean is the TOEFL for undergraduate students, because they have to pass the TOEFL. That's our accreditation standards, and the GRE for the graduate, but we're a little flexible with the GRE. But other than that, the world is open. You have to speak some English, obviously, because if you're doing, but everything else works very well. So
I think you have more question for Dr. Thank you, Dr. Anahid. Thank you very much. You're welcome. No, for Dr. Shahrazad. For Dr. Shahrazad.
I would like to ask Dr. Shahrazad. Okay, I would like to thank everyone who is presenting for us today to enrich our conference. And I have two questions. One of them for Dr. Shahrazad and the other one for Dr. Atif. Dr. Shahrazad, you are learning us many times. You are teaching us many times. But till now, at the level of undergraduate and the postgraduate, we are not able to change our students to be learner. We have to teach them. So how you can help us to change our student to be a learner rather than a teacher? And from Dr. Atif, you are one of our ethical committee and research. What about this module that you are prepared for us to be applied in our research, in our faculty? Did you feel that we are applying this content or it's included? Thank you.
Thank you, Dr. Jehan, for your question. I don't think this question can be answered because it's the role of all of us to teach students how to be learners. Thank you.
حاضر ثانية واحدة لو سمحت ثانية واحدة اتفضل
You ask about the 20 element. The 20 element. Yes, we already checked this for everyone providing any protocol, MS or mass doctor, PhD, or for the ethical committee. Not all, but I'll try. Everyone missing something, I'll call him, and even I talk to him personally to complete this.
Okay, Dr. Atif. Dr. Amal,
I'd like to
would
ask questions to Dr. Anahid. Please, Dr. Anahid. Anahid. Please, doctor. Thank you for presentation. Your presentation. Please, I'd like to you talk about the image of nursing in developing countries. I think one of the challenges of nursing, beliefs and the values of nursing, beliefs and the values about nurses and nursing in developing countries. You don't talk about the perception of nurses or nursing as a profession in developing countries. It's considered one of the challenges.
Right, because in developing countries, it's still, and I go back with the low wages and shortage of nurses, people still perceive that the nurses are the ones who change bedpans and that's about it. And we need to change that with the increased clinical expertise, and we need to make sure that those skills are always, the patients are always exposed to those skills rather than, I'm not saying bedside care is not important. What I'm saying is that the perception in developing countries is that that's what the nurses do. And because they don't get paid very well, that adds to the negative perception. So what we need to do is giving them better working conditions so that they can do the best job, making sure that their clinical skills are up so that people can see what the nurses are doing in terms of changing their lives, and of course, providing some opportunities for advancement. I remember a long time ago, whenever I said I was a doctor, and everybody would look at me and say, doctor in what? I'll say nursing. This was in the United States. And they say, are there doctors in nursing? So you had to convince them. But nowadays, that has been long gone, that perception. Everybody understands that there is doctors in nursing, so they don't argue that point. So it takes time, but we will get there together.
شكرا. Thank you. طب another question for Dr. Kaslin. Please, Dr. Kaslin, I'd like to ask about, at the beginning of your presentation, you talk about there is a lack of improvement in nursing in Egypt in the last 30 years. How did you judge about that?
Hi, my experience is exclusively here at this hospital, so I'm not able to speak about nursing practice throughout Egypt. But what I can speak about is what I've seen for the last 5 years in my observations. When I come here, I go with the nurses to the floors. I conduct an assessment, the same as Joint Commission would. So I am able to observe the practice like Joint Commission would, and the practice from what I hear about the Mideast and Egypt is not the same. It's actually elevated practice here of nursing, very close and similar to the United States. So I think with all the effort that this hospital puts into nursing, they value the nurses, they train the nurses, they include the nurses in opportunities that physicians have and pharmacists and other disciplines. That has raised not only the image, but the actual caring and practice of nurses. And as you see, Dr. Sharif showed the outcomes of the oncology patient are close to what we have at our center in the United States. And I will quote a surgeon that I work with. I work with a very famous neurosurgeon back at Boston, Harvard University, and he always says at meetings, without a great nurse, I am nothing. I can do the best surgery on the patient's brain, but if the nurse does not understand what a head bleed is, not able to care for the patient, and he dies, then what good is that for the patient or me? So American physicians recognize the importance of having a well-trained, skilled nurse to take care of their patient. The doctor in the United States is with the patient in the hospital for 5 minutes. The nurse is with the patient 24 hours, 7 days a week. So it's very important to have the person spending the most time with the very sick patients to be trained and educated. And I see that here in this hospital.
And it's your observation or opinion about the nursing in Egypt, but there is no statistical statistics about the achievement or improvement in Egypt. Yeah.
Yes.
Thank you, doctor.
Thank you.
Thank you very much. Are there any other more questions or query, or that's all? Allows for the هتعمل announcement for the break.
I have one.
primarily, I want to thank Dr. Angel, Ms. Kaslin, Dr. Atif, Dr. Shahrazad about their presentation. And I'd like to add my suggestion to Dr. Angel about aspects and principle and views to improve the nursing image. You talk about improve ongoing training and educational program, put a policy and procedure to set a limit and about errors and mistakes in the working place. But you don't talk about one dimension miss from this presentation about religious and spiritual dimension to the nurse and improve conscience regarding the care of patient. The another one, ethics, not ethical issue about Dr. Atif Kalman, but ethical aspects about caring of patient and feeling of that. Added to that, Dr. Ms. Kaslin talking about improve the image of nursing, and I need to add that nursing not a profession by meaning, but it's a profession and spiritual together. Add to that religious is a main and important aspect we need to learn and to involve in the nursing corporation. Thank you.
I can comment if you want me to comment on your comment. Should I comment on your comment?
Yes, it's
All
comment,
right.
not us.
First of all, in the standards of nursing, standards of care ethics is one of the givens. So we didn't talk about it because it is expected of the profession at the baccalaureate and the ADN level. We do talk about religion or basically spirituality in the curriculum, undergraduate and on. But we have to, in the United States, be careful as to talking about religion from the religious perspective of the caregiver, because we're not supposed to impose our religion to our patients. We respect the patient's religion, but we can't support or condone in some ways that shows that we are either approving somebody's religion or disapproving somebody's religion. So in our basic curriculum, yes, we have to include the spiritual care. In our transcultural, we have a book in transcultural nursing. I have a chapter in there on the Arab client. And I have what Islam and Christianity means. So yes, those are givens. We took it for granted that everybody knows that and it's expected from the profession. But we can talk about it more if you want to. So.
Thank you.
Please, the last question from Ahmed for the time.
The question is for Dr. Anhida. I'm here.
Oh, okay.
Thank you for a good presentation, excellent presentation. My question related to NCLEX examination. You have mentioned at the presentation that about 36% of nursing all over your university, all over your country is all over your state is having bachelor degree. So and at the same time there is a need for nurses all over the world, and this guides us for the point that there is a need for a NCLEX examination in order to work at USA. The issue is that at all Middle East there is no NCLEX examination center. So my question is related, if there is a chance to make an examination center at Cairo University, Faculty of Nursing, and this would be the first NCLEX examination center all over the Middle East, and I believe it's all over Africa, because I have searched online, I didn't find any examination center all over Africa.
Right.
So I hope if there is a chance or a channel of communication we can follow in order to perform or to apply this.
But we can work on it. I'm sure it's a big political and policy issue. And financially, it's very good for the locals to be able to come to Cairo rather than go to Europe or United States to take the NCLEX. It's a good idea. That's why we, in the United States, added those centers for NCLEX so that it can make it easier for the international nurses, graduating nurses who can take the NCLEX. And yes, we do need baccalaureate prepared nurses. And I have to say, because I come from Lebanon myself, I am very careful to not take all of them in the United States, because what happens is that the more we accept from overseas, the less there is for overseas to take care of their own patients. So I play sort of ethically. I am always in a dilemma. I had admitted 3 PhD students when I was at the Florida International University. 3 of them wanted to stay in the United States. And I kept on saying, you need to go back to Lebanon and Jordan so that you can help the Jordanians and the Lebanese. So it's a dual process. We have to make sure that we don't drain the nursing workforce. So thank you. I feel like I'm Oprah, but is that the last one? If we are done, I'd like to actually give our appreciation to the Dean of Nursing at the Cairo University. So if you want to come up so we can give you a little gift from our university to your university. Here. Oh, you're welcome. And we'd like to open it so that we can take a picture with all the, yes, with all our faculty. And then did we have the little, that's all. No. Okay, let's go. Let's all go. I don't know. Let's see.
السادة الحضور، في خلال البريك أي حد من السادة الحضور الأفاضل لو حابب يعمل تور في المستشفى يتوجه لقسم العلاقات العامة في الدور الجي. ماشي، في قسم العلاقات العامة فعند أحمد. البريك حضرتك خلاص. احنا البريك ان شاء الله نص ساعة، واللي هيتوجه لأي تور في المستشفى يستل في الأوديتوريوم، وقسم العلاقات العامة هيجيله لغاية عنده. شكرا.